Why would a booster shot give you a headache and a fever? Why are health experts urging the public to get the third shot? And how does it protect you anyway? Keep watching to learn more. Throughout your lifetime, you've probably received a whole lot of vaccines to combat serious diseases like measles, polio, hepatitis, and tetanus. Many of them require 3, 4, or 5 doses, or even an annual shot, as is the case for the flu. Boosters for all diseases have a pretty simple purpose. They help you maintain a robust level of immunity so you don't wind up severely ill in a hospital, or worse. Dr. Anthony Fauci, chief medical advisor to President Biden, said in an interview with NPR in December, "We know that when you boost someone, you dramatically elevate the level of antibodies and other immune parameters that can protect you against infection, but much more likely against severe disease. So going into the winter with the challenge of the colder months, that's what we have to do in addition to the other things, like wearing masks when you're in indoor congregate settings."
If you get the booster, you're really in good shape.
Boosters have proven to be safe, said Dr. Marcus Pereira, assistant professor of medicine at the Columbia University College of Physicians and Surgeons. In a Pfizer study of 10,000 participants, Pereira said, researchers found no new adverse effects from the shots, and those results were similar to what has been observed in previous studies. So your booster experience should be predictable and similar to your initial vaccine series, or even milder. Side effects generally resolve after a day or two, according to Yale Medicine. Robert Weber, administrator for pharmacy services at the Ohio State University Wexner Medical Center, told AARP, "I think people also understand how to manage the side effects better in terms of drinking plenty of water prior to getting a vaccine, drinking plenty of water after you get the vaccine, taking it easy the next day." After receiving a COVID-19 booster, you'll most likely experience some injection site pain. It's one of the most common side effects, according to the CDC. As Single Care explained, this side effect is a typical complaint with many vaccinations. Between 65 and 82% of people will experience injection site pain following the COVID-19 vaccine, the site revealed.
No matter which brand it was, it's pretty likely your arm was sore afterwards.
However, you may be able to minimize arm pain following your booster. Permanente Medicine suggests deciding beforehand which arm you want for the vaccine injection. The non-dominant arm is a good choice, so any pain or stiffness doesn't interfere with your activities. But others may prefer basing it on what arm they typically sleep on, as leaning on a sore arm can make for some rough nights. Other helpful tips from Permanente Medicine include relaxing your arm upon getting the injection and then keeping the arm active, such as making circular motions to increase blood flow, as this can lessen pain. Taking Tylenol or Advil after getting your shot can also help reduce muscle pain or swelling. With the Pfizer booster, which is the same dose as the initial series, the data collected shows that side effects from the booster are similar to the second of the initial 2 doses, or even milder, according to AARP. The organization reported, Pfizer's trial found that, compared to adults ages 18 to 55, those 65 plus were less likely to experience these fatigue or flu-like symptoms after receiving the booster. AARP noted that while Moderna's booster shot is half the original dose, the side effects are also similar to the second dose of the 2-part vaccine. Data show that fatigue is common, as 56% of recipients reported experiencing the side effects post-booster. Dr. Peter Marks, the U.S. Food and Drug Administration's acting director of vaccines research and review, said he experienced fatigue after his own COVID-19 shot, telling the Associated Press, "The day after getting these vaccines, I wouldn't plan anything that was strenuous physical activity." A headache is common with all the COVID-19 vaccines, and this includes boosters. Dr. Brian Grossberg, director of the Hartford Healthcare Headache Center, told Single Care that people experience headaches from the vaccine because of the body's initial immune response. If you experience a headache after receiving your booster, you can treat it in much the same way as any other headache. Dr. Colleen Kelly, an associate professor of medicine at Emory University School of Medicine, told USA Today, "It's perfectly fine to take anti-inflammatory drugs or Tylenol if you are feeling unwell after vaccination. The symptoms you are experiencing indicate that your immune system is functioning normally and that the immune response is ongoing. The occurrence and severity of post-vaccination headaches vary." Dr. Jason McKnight, a clinical assistant professor at Texas A&M College of Medicine, told Single Care, "Many people will have no headache at all after receiving the COVID vaccine. Some may have a mild headache, while others feel their headache is severe enough that it limits their activities for the day." Safety data indicated that people had fewer reactions after their third dose than after their second dose, CDC Director Dr. Rochelle Walensky said in a White House press briefing in November 2021, referring to COVID-19 boosters.
I encourage you to go get boosted.
One of the most common side effects, she explained, is achiness. But don't worry if you're not feeling that symptom. Dr. Mark Loafman, chair of family and community medicine for Cook County Health in Illinois, told NBC5, boosters for some people are completely asymptomatic. Boosters for other people trigger their immune response against it, so they have some inflammation with it. What's the best course of action if your booster hits you hard with flu-like muscle and body aches? The CDC says don't pre-medicate with over-the-counter drugs like ibuprofen, acetaminophen, or even antihistamines in anticipation of those aches. It's not clear if those drugs will curb your immune system response and possibly blunt the effectiveness of the vaccine. However, taking an over-the-counter pain medication afterward is okay for most people. Fever is not an uncommon side effect of the COVID-19 boosters. The fever usually starts within 2 to 12 hours after getting the vaccine. But guess what? It's just your body's normal response when building antibodies. In the Pfizer clinical trial, adults 65 and older were less likely to experience these symptoms after receiving the booster when compared to adults ages 18 to 55, according to AARP. Moderna trials concluded the same thing. If you're experiencing fever after your booster, rest assured that it's normal. Treat it like you would any fever. The CDC recommends drinking plenty of fluids. If you find yourself waking up after receiving a booster shot with your teeth chattering and you just can't get warm, don't worry. Getting the chills is on the list of common reactions to COVID-19 boosters, according to CDC data. This is what happens to lots of people when their immune system is revving up. The body detects a foreign intruder, white blood cells swarm to the site, and the resulting inflammation hits you as chills and other symptoms. Drinking more fluids is thought to decrease some of these symptoms, said infectious disease specialist Dr. Mark Herbert while speaking to the Columbus Dispatch. Herbert also said, in agreement with the CDC, that adults taking Tylenol or similar over-the-counter medication can also provide some symptom relief. While it's not one of the very top complaints, nausea and vomiting can unfortunately happen after getting the vaccine or booster, according to the CDC. To relieve nausea symptoms, Dr. Michael Daigneault, an emergency physician based in Los Angeles and chief medical advisor for Reliant Health Services, recommends drinking lots of water in the days before you get the vaccine. He continued, telling USA Today that sipping ginger tea can also be helpful in managing your discomfort. In addition to staying hydrated post-vaccination, it is wise to eat light foods for meals, like soup or crackers, just like you would anytime you feel nauseous, Dr. Natasha Bouillon told Bustle. Symptoms should subside within 48 hours. It's a normal reaction, but it can be alarming if you feel a swollen lymph node in your armpit after a COVID-19 vaccine. These small glands are part of your immune system. According to Nebraska Medicine, your lymph nodes are activated to produce white blood cells, which fight off infection. This causes the lymph nodes to swell and possibly to become noticeable to the touch.
Your lymph nodes are the factories for making those antibodies.
Swollen underarm lymph nodes can occur with all boosters, but is more commonly a side effect of the Pfizer booster, according to the FDA. According to Yale New Haven Health, swollen lymph nodes following vaccination can last up to 10 days, and they can be seen on routine screening mammograms for up to a month after vaccination. For that reason, women should schedule their routine screenings 4 to 6 weeks after their vaccine. The COVID vaccine does not cause breast cancer or increase your risk for breast cancer, but it can make lymph nodes larger, said Dr. Lisa Ann Mullen, Breast Imaging Fellowship Director and Assistant Professor of Radiology and Radiological Science at Johns Hopkins Medicine, in an interview with CNN. Reports of fainting after receiving the Johnson & Johnson vaccine made the news cycle early on in the distribution process. But guess what? In the majority of cases, it was actually anxiety that was causing it. A CDC study researched the events and concluded that most symptoms of lightheadedness and fainting were anxiety-related events, and that can happen after any vaccination.
It's very common. People should not use that as a barometer for not taking the COVID-19 vaccine or other vaccines.
The episodes generally lasted only about 15 minutes and were experienced primarily by women, with a median age of 36 years. Furthermore, 20% of the patients told vaccination site staff that they had fainted before while receiving injections, or simply had an aversion to needles. Dr. David Wall, an infectious disease specialist at UNC Chapel Hill in North Carolina, revealed that fainting is a pretty common reaction to needles, telling CBS 17, "We see it with the flu shot. We see it with all types of vaccines. Your heart rate, instead of speeding up as your blood pressure drops, slows down. Every day, there's people who faint when giving blood. They faint when they're having their blood drawn for a blood test. That just is very, very human." Some lucky individuals have no reaction at all to receiving the COVID-19 vaccine or booster. How can that be? And should they be concerned about not feeling any side effects? As it turns out, there's no need to fret. Side effects are not necessary to show effectiveness. In a Johns Hopkins medical study, researchers looked into this phenomenon and concluded that regardless of symptoms, most participants developed antibodies 14 or more days following dose 2. The person who didn't develop antibodies was taking immunosuppressant medication. So you can celebrate if you are feeling no pain after your booster. The experts agree that your body's response to it is working just as intended. There is another end to the spectrum of booster side effects. Like all medications and immunizations, some rare reactions can occur. One of those is anaphylaxis, which is a severe allergic response that causes blood pressure to drop suddenly and airways to narrow.
My throat started, I started doing this a little bit. I had my mask on and I told my husband, "Can you roll down the window? I'm having a little bit of problem breathing."
Such reactions happen very quickly, just 15 to 30 minutes after vaccination. This is why when you get any of the COVID-19 vaccines or boosters, you're asked to wait on site for 15 minutes before leaving the facility, out of an abundance of caution. Another rare potential side effect that has affected some people, mostly male adolescents and young adults, is the development of inflammation of the heart muscle or inflammation of the lining outside the heart after receiving the Pfizer or Moderna vaccines. However, according to Johns Hopkins Medicine, most cases are mild and recovery is quick. These conditions are more likely to occur as a result of a COVID-19 infection rather than as a side effect of the vaccines. As of January 27th, the CDC's stats show that over 75% of Americans have already gotten one COVID-19 dose, and 63.8% are fully vaccinated. Additionally, 41.5% of the fully vaccinated U.S. population has received a booster shot. Dr. Aaron Millstone, Associate Hospital Epidemiologist at the Johns Hopkins Hospital, told NBC's Today, "If you're weighing the side effects of the vaccine versus the effects of COVID, I would take the side effects of the vaccine any day." In view of the infectious Omicron variant, Dr. Anthony Fauci said in an interview with CNN that, quote, "It's going to be a matter of when, not if, the third shot will be required for a fully vaccinated status." He explained, saying, "For me, as a public health person, I just say get your third shot. Forget about what the definition is. I just want to see people be optimally protected."
I'm certain we're going to need that third dose looking at the data that we've seen.
And although Pfizer and Moderna are working on Omicron-specific boosters, medical analyst Dr. Leanna Wen told CNN that you shouldn't wait until they become available, saying, "Everyone eligible to receive a booster should do so now." Check out one of our newest videos right here. Plus, even more Health Digest videos about the latest vaccine updates are coming soon. Subscribe to our YouTube channel and hit the bell so you don't miss a single one.